Joining us in studio, Dr. Jonathan Tripp.
Good morning.
I've got to make sure that your microphone is working, Doctor, because you'll be shouting otherwise.
Well, are we on?
You are. I
Any,
was, I was,
anybody out there that can hear me?
I was going to say though, you don't really shout too much.
No, not unless I have.
Your bedside manner is pretty good.
Yeah, no, they hide my true personality while I'm at work. So,
Hey, we're talking today a little bit about imaging issues and the like. It was a fascinating little rundown that I was looking at because there's all of these different procedures, but then at the end it talks about patient rights and things along those lines, which, in other words, basically you can't be told this is where you have to go, this is what you've got to do. There's a number of options a patient would have.
that is true. And luckily, so far in Idaho, we still have most of those patient rights. One of the things that's going to change with our healthcare law, and the consumers don't really know this yet, but we see it as we sign contracts that create more and more what's called managed care. And so patients, when they fall into this, are very frustrated because they're used to being able to say, well, I want to go see this doctor, I want to go to that place, or no, I don't want to get my test done here. And those are the patient rights that, we've given away by signing for, a cheaper insurance contract, because then the insurance company really says, you will do it our way if you want to pay our premium, our lower premium. And this happened with Pacific Source. They came in and said, hey, we have a Medicare Advantage plan, and we have no HMO, meaning no managed care. This is just, the best thing since sliced bread, and it's cheaper, and all the seniors are going to go for it. Do you want to sign up as a physician? And we double checked, made sure there was no managed care part of it, because I've lived in the areas like Phoenix and areas that have a lot of managed care, and your choices are very limited. And then a year later, we had husband and wife show up on about January 1st that said, we need referrals to this specialist and that specialist and this one and that one, and we need it all right now. We need it for 6 visits throughout the year. We said, wait a minute, we're not in an HMO. And they said, yeah, you are, because we signed up for the cheaper program and you're on the list. So we went back to our contracts, and the truth is there was no HMO when we signed it, but the insurance company basically slid that in and just said everybody that's already on our current contracts is now on our other one. And so I can opt out, but essentially I have to tell patients I will no longer be your doctor. So, there's some slips that some tactics that are a little more sneaky than others. Another one that is really one that our listening audience is not aware of is Select Health, a great insurance company, brought in by Intermountain Healthcare combined with St. Luke's, now owned entirely by St. Luke's. And then the Physicians Network, again, trying to be entirely owned by St. Luke's, says, hey, we're your buddy. We're going to be cheaper. We're going to take better care of you, but we will own you. And so, that's something I usually don't bring up much negative about our current location, because this is coming, it's happening, and we're not aware, and our consumers won't see it for about a year or two, and then
Notions to control costs, really, everybody's under pressure.
Yeah. And I would encourage anybody to read the Idaho Statesman that had a little bit of information about the indictment against St. Luke's and Boise and their predatory competitive practices that never got any press here in our local town. So that's all I'm going to say on the negative side for insurance, because I actually came in with almost a different direction. We're going to talk about X-rays and CTs and MRIs, but I really wanted to come in and say, hey, as I drove in, I thought, we just have an unusually good place to live. And, I do well child checks, and part of the discussion I have there is questions about drug exposure. And it's always a shock for me to give national statistics to parents and their children who are, 12, 15 years old, and say, the average age of a child that is first exposed to marijuana or offered it is age 9.
Wow.
Nationally. And the average age that they actually try it is age 11. And I'm usually talking to a 12, 13, 14-year-old who has never had it offered to him here. And I think we have, in a lot of ways, a protected community, a community of parents that are involved. We have a nice environment. And I just think, as I drive in, this is a place that's worth living. worth enjoying, and that we often talk about the negatives like I just was. But this is a great place, and that's why we're here.
Well, we'll talk a little bit about those imaging options and things coming up in a few minutes. Dr. Jonathan Tripp joining us in studio. It's 75 already. Bill Colley with you as well. It's called Better Health. And from Tripp Family Medicine, on top story with us today on News Radio 1310 KLIX. Joining us in studio, Dr. Jonathan Tripp from Tripp Family Medicine here in Twin Falls, located on Fillmore Street. And of course, we call it Better Health. And we do this on Wednesday mornings between 8:30 and 9 o'clock. We should mention that people, if they'd like to contact the office, there's some easy ways to do that.
There is. You can walk in the door. No, we're across from the post office on the
I've done
north
that.
side of town. Yeah, you have walked in there. Our phone number is 933-4400. Our website is trippfamilymedicine.com, and our Facebook page is Tripp Family Medicine. So any of those ways, we'd welcome have you contact our office. And always working with new patients. And we're actually, let me tell you a little exciting news. I've spent the last 2 days with a physician assistant who has awesome experience both in clinic and in ER, and we've been looking for somebody to add on to our practice. And if I get my way, we'll have him here later in the fall, and I think he'll be a tremendous addition to Russell, who's our current PA, who is remaining. He's not going anywhere. Myself, and we even have a part-time nurse practitioner that's going to start with us in about another month, and we're looking forward to her presence in our office. So we're growing, and you have options. If you say, you know, that Dr. Tripp, he's nice, but he's really not the guy I want to see, you have some other options. So, like,
I'm not sure anybody's saying that.
I'll try not to keep that reputation.
You have a story that's a very personal story today when it comes to imaging, and you wanted to share a little bit of that.
Yeah, this is my father-in-law's, really the story of his demise. This is a very healthy guy that, at 75 years old was frequently challenging 18-year-olds to push-up contests. So, this is a guy that was in good health all of his life, avid athlete. I would not say an overeater or trouble like that. In fact, every time I'd show up, first thing he'd ask me is, when am I going to lose my belly? So he put a lot of pressure on me. But we went to visit. He lived in Michigan, and we went to visit, and he'd been feeling kind of down, not so great for about 2 months, but didn't really tell anybody, but kind of slowed down, and was starting to get some dizziness, some imbalance, and nausea that went with that, which is a real common side effect with things as simple as sinus infection or vertigo. But it just got worse while we were there, and I said, we're going to take you to the emergency room, and I'm going to give you the right words to use so we get you checked out sooner than later. And so we approached it as if he's having a heart attack because he was diabetic, although very well controlled. And diabetics, their only symptom of a heart attack sometimes is nausea. And so we went that route, and sure enough, they did what's called an echocardiogram, which is an ultrasound of the heart. So there's imaging technique number one. And while doing that, noticed, because they catch part of the liver next to it, they noticed there were some spots on his liver, which usually is a worry for either cysts or cancer. And so once they did that, they said, hey, we want to do a CAT scan of your chest and even your tummy and see what these look like. So a CAT scan is really a fancy set of x-rays that cuts kind of through the middle of your body. Instead of just taking a picture, this one is more like a picture from the ground up, looking up at your head. So it takes a slice at a time and is more detailed. And they found that, yes, indeed, he had metastatic cancer in the liver, but not only that, but found it in his lungs. And because he had the dizziness, what they call neurological symptoms, they said, we want to keep you overnight, and we're going to do an MRI tomorrow on your head. So there's your third imaging technique. An MRI is um, really a big magnet. And, they put you in this tube that has a magnet that moves around, and they turn the magnet on and off. And the amazing technology that it is essentially takes a water molecule, which has oxygen on one side, kind of like a triangle. The two bottoms of the triangle are hydrogen. And the hydrogen create a positive side of the magnet, and oxygen a negative side of, not the magnet, but the molecule. And then when you turn the magnet on, it changes the direction or the position of all the water molecules in your body instantaneously, and then turns it back off again. and in the same instant is taking an image which shows everything where water is, and that's every soft tissue as well as bone, and they can see a lot of detail. So a lot of times somebody will get a hurt leg or arm and they don't have a fracture on X-ray, but if you do an MRI, you can see a bone within the bruise, a bruise within the bone, which is a fluid collection that you'd never see on an X-ray, never see on the exterior of the body. So MRI is really a soft tissue delineator. It really tells us the story a lot of times. So the end of the story for my father-in-law is they did the brain MRI, and sure enough, he had tumors there as well. Did a biopsy on the liver because that was the easiest place to get a piece. Found out it was metastatic melanoma. He was a sun worshiper, but we never found where the original melanoma was. So imaging was a big part of the last 6 weeks of his life, but this is a testimonial to you got to watch a lot of different things. It's not just about what you eat, how you exercise, but at the same time, you got to pay attention to the skin. But that's a great story to say, why would you use different technologies? Um, so I want to tell you a little bit about my training. And anybody that would like to call in and has a story about their imaging or what they did or what was good. Sometimes we find things incidentally. Sometimes it's cancer. Like several times I've been doing a CAT scan on somebody's abdomen, pelvis for a whole nother reason, like we're trying to rule out an appendix or
Hmm.
gallbladder. And they see the kidney and they say, wow, you got something on the kidney. And turns out they're able to cut out a piece of the kidney and cure what otherwise was called renal cell carcinoma that would later have spread and killed the person. And it's done, it's over. And so sometimes we find things incidentally and really helps prolong our life. And so imaging, I don't want to say x-ray for everybody every day. That's not a good idea because there are some health hazards, but there's a lot of good things that come about when we're doing imaging, a lot of help with medicine.
I think that in my own case, I think I've had X-rays obviously done, and when I was going through the sleep center process, the endocrinologist also had an EKG done, but I've never really had anything beyond that. And most people likely never go through all of these procedures, right, in the course of their lifetime.
True. I mean, if you have a certain health problem, you tend to have repeat experiences. I will say that there are some traveling health organizations that say, hey, we'll do an ultrasound and we'll do this and that, and for a nominal fee. And I often have patients come and say, is this worth doing? And I ask the question of, well, how much are you really spending? And it's often about $150. And I say, well, if they find anything, then it's worth it because that same one of those tests probably would be $300 to $500, and there's quote giving you three different tests. And so I'm not opposed to outside non-physician directed imaging, but I would caution people to say if somebody says, hey, we can do a CAT scan on you, CAT scan is a lot of radiation, so I wouldn't just willy-nilly say, yeah, why don't I do that? But ultrasound is pretty benign. It, as far as I can tell, has no health threat. It's a technology using sound waves to bounce off soft and hard tissues. We use that for things like looking at a gallbladder, looking at babies, when mom's pregnant and we're trying to figure out is this baby developing correctly? And of course, everybody wants to know the sex of their child by the time they're, into the third trimester.
Hmm.
So, those are things that we can use ultrasound for. Ultrasound is gaining in favor of you being used for joint injections and other things for sports medicine. One of the fun things, switching gears, is a technique called fluoroscopy, which is really just, if you think of the old moving picture cameras, the Super 8 type camera, using an X-ray in that same frame by frame moving picture, they'll use that to do steroid injections at the spinal cord called epidural steroid injections. It's something I actually trained in my residency. Very sophisticated technique and avoids surgery for a lot of people.
We have a caller with us. It's 8:53. Dr. Jonathan Tripp in studio with us. Tripp Family Medicine on Top Story with Bill Colley on News Radio 1310 KLIX. And you're on the air with the doctor.
Yeah, my wife has recently been diagnosed with melanoma, stage 3B, metastatic melanoma, uh, and had gone through biochemo and done. Now they're saying that she needs to have uh, MRIs every quarter for the next 3 years to check things out. Is this something that you agree with?
Well, an MRI is a costly imaging technique, but without having really any other way to see inside the body as sophisticated as an MRI, and knowing how life-threatening melanoma is, I absolutely would agree with that one. And
Yeah,
it's a cost issue more than a health threat because the MRI really doesn't cause any threat to her physically. It's just helping see what they're able to see with an MRI. And it's not perfect, but it sure helps a lot more than even a CAT scan or a ultrasound in her case.
and just like your father-in-law, they've never, ever, they haven't found her primary yet, and they keep checking her for it. But we can't find her primary, but yet it showed up in a lymph node.
Wow.
So,
And the only place that I can think of, not on the outside of the body, that would be worth looking at, because it can show up on other organs without you ever knowing where it was, but the back of the eye. So if she hasn't had a good eye exam by an ophthalmologist, somebody who is an eye surgeon, I would have them do that. Not that that will change her prognosis, but it sure would be. It'd be nice to know where this darn thing started.
I want to thank him for the telephone call as well, and we do hope and pray that his wife gets better here and soon.
Yeah, no, she 3B is bad, but it's sure better than stage 4.
What was it? The singer Eva Cassidy showed up for a recording session one time with a cane and said, "I have a sore hip," and 3 months later she was dead from melanoma. And sometimes people just don't really get a lot of warning when they have something like this, do they?
Yeah, no, cancer in general is just, it's what we all, or at least a lot of us, dread. Maybe not everybody, but it's the unknown, it's the unpredictable, and so we do the cancer screenings that we know how to do. But an example of ovarian cancer, if you pay your own money and say, I want to get an ultrasound to check my ovaries, you can do that. Your insurance will not pay for it as a screening. And so, but there's no other than what's called a pelvic exam, which is a rough, meaning not very sensitive way of testing for ovarian cancer. We don't have a good way to test for that one. We have great tests for cervical cancer, testicular cancer, prostate, colon cancer. All of those have kind of planned preventative health care screenings, but there's several, and breast cancer. Breast cancer has the most information across any demographic. In fact, I'm often teaching women now you don't have to do your self breast exam every month, which we taught for years and years. Big study that actually came out of China with about 44,000 women found that if you do it every 3 months, so 4 times a year, it's every bit as good and identifies cancer as early as if you do it every month. So that sometimes is a relief of guilt for women that don't get it done every month.
The
So
imaging, though, the only other way that you would be able to find out would be to cut someone open, and that's not really what you'd like to do.
yeah, no, we talk about other things about like exploratory you know, abdominal surgeries when we have pains that can't be identified by imaging. But, those are pretty few and far between nowadays. It's really frowned on to open up a belly just because you can't see anything on the outside.
Because that's that. I mean, obviously, any surgery is risky, right?
Yeah, it's risky from the point of view of the anesthesia, but, at a minimum, anytime you put a hole into somebody's belly, your body inside creates scars called adhesions, and then those adhesions can cause intestinal blockages or other problems. And then you got to go back and do another surgery to get rid of the adhesion, which begets more adhesions. So we would much rather do imaging than we would opening somebody up.
I do want to mention we'll see you again next week. Today, though, you're still doing physicals for students,
Yeah,
right?
we have
Sports physicals.
sports medicine, or not sports medicine, sports physicals from 3 to 6 p.m. And it is high time for everybody to get into their fall. It's hate to say fall, but their sports tryouts are going on, starting right now for a lot of the teams. And next week, we're going to talk about how to beat the bugs at the return to school. How did we title that?
Uh,
Beating the back to school bugs.
yes.
And so we got some fun stuff to talk about there.
Dr. Jonathan Tripp joining us in studio. Very quickly, the telephone number at the office today.
933-4400. And if you're coming for sports physicals, print out your form on the Idaho State Athletic site or their school district site. Fill it out and bring it in, and bring your parent with you. Thanks.
News is coming up next from Fox at 9 o'clock. You're listening to News Radio 1310 KLIX.